Dr. Dutson.
Hey, Christy. So the last one was to demonstrate your ability to use both hands together. This is the intercorporeal knot tying part, or suturing, and it has an obvious application where a lot of what we do when we're operating is sewing things up that we've cut apart. So this is a chance to show skill at suture tying, stitch throwing and suture tying. So there's a specific way you have to do it, and I'll try to walk you through that. Okay. One of the hard things is getting the needle to go through this piece of rubber, and in order to get it to go through, you sort of need a little bit of tension on the rubber, and you've got to cock your wrist back. Do you feel how I'm cocking my wrist back a bit?
Okay.
And then you want it to go in on one side, one black spot, and come out on the other black spot.
What if it doesn't come out on the other black spot, but somewhere pretty close by?
Well, I think we're counting pretty close by for this experiment because it's sort of a challenge to use this system. So once you've got it through both of those, then you should pull your suture through. Do a little pulley technique here, it makes it easier.
Oh, okay, I see.
And then, according to the test rules, you've got to switch the needle out to your right hand for the first one.
Okay.
And then you make something called a surgeon's knot, which is throwing the loop twice. I'll show you how we do that.
Now, when I have a feeling, this is probably a dumb question, but when I'm doing this, you're not going to be talking me through it, huh?
No, you got to do it on your own.
Okay.
But I will be able to tell you make the double knot here.
Okay. Switch the. Okay, cool.
Okay, when I've got the needle in my right hand, what I want to do is wrap it around my left hand twice. There's one. There's two. Tie it tight, and you got to switch hands and hold the needle in your left hand.
Oh, so you're just doing another knot? Okay.
Yep, nothing special.
Okay.
And then for the last one, I think that was a knot, wasn't it? Holly, can you tell I'm having trouble?
Yeah, that
Okay.
was it.
The resolution's sort of poor, so I can't tell. Okay, so that's tight. And then I'm going to go back and grab the needle with my right hand again. I think. And that's basically it. Then you're done at that point.
Okay.
Holly, how are we
Got
doing?
about 7 minutes left.
Okay, I'm going to keep throwing knots then. And, you know, if the machine overheats, we'll stop. At least I think I'm going to keep throwing knots. It's funny, I think the laws of physics change periodically to frustrate me. For example, the odds of that thing being exactly where I can't reach it are about 10 million to 1. It's nevertheless managed to get itself right there.
It found a way to find that spot.
Right. So the key for this is that each time you should switch hands. Now that last time I had the needle in my right hand, so now I have to switch it to my left hand. And then again, you just make a loop like this. Now I'm going to go back and grab it in my right hand.
Can you talk while you do this, or do I need to just be quiet?
Yeah, please go right ahead.
Well, a couple of things. I work in surgery and pre-op and recovery here at Eisenhower. One of the big questions with the folks who had the laparoscopic surgery, especially when the guys started doing them, is they took so long.
Yeah.
So the the patients were kind of concerned, you know, here's a 30-minute procedure that's now taking 4 hours.
Right.
You know, they're under anesthesia for almost 3 or 4 times as long.
Right.
Have y'all seen any risk or benefits, or, I mean, benefits obviously, but the risk from the extended length of surgery?
Well, I mean,
While the learning curve is being established.
one of the purposes of this sort of task is so we don't see those big increases in time. Anesthesia by itself is not too risky these days, unless you have a really sick patient. If you have somebody who's really sick, you don't want them on the table for a real long time. But in the beginning, when they first started doing this, they didn't really have any way to learn except by doing it. So doing it slow and right is much better than doing it fast and not so good. So that's where the increased times came from. And the only reason that that's tolerated, or was tolerated, is because anesthesia is basically so much safer than it ever used to be.
Okay.
Does that make sense? Now, one of the emphases now in surgical education is to do the learning outside of the operating room before you even get there, kind of like pilots do. You know, because if you're learning on grandma, that's not the best way to learn.
Yeah. Your daughter probably doesn't appreciate it.
But that's the way everybody learned. That's the way I learned. It's the way Dr. Walsh learned. But we're trying to change that. That's why we're doing this kind of a research experiment. Stephen, I think my left hand is not holding. This suture keeps slipping out.
Will you come back out and do a couple of grafts?
Sure, hold on 1 second.
It looks like it's grasping fully here.
Yeah, maybe I'm just not squeezing it hard enough on my end.
Must be the operator.
Probably.
Oh.
Probably.
Graduate now.
You're pretty much out of time, so.
Okay.
Can you go to home position for me?
Yep.
Yeah. Thank you. Good job. You kill it, Christopher?
Yep. It's kind of a problem, huh?